Well, the pandemic has led to a dramatic rise in mental health issues among the young, the unemployed, and those who face new financial insecurities. That's according to the Organisation for Economic Cooperation and Development. It says the social and economic costs of mental ill health and care is a long neglected and underfunded area. Here's Juliet Mann. Juliet.
Thanks, Jamie. Well, on average, half of all people experience a mental health condition at some point in their life. And that can make it harder to stay in school or employment, harder to work effectively, and harder to stay in good physical health. Add a global pandemic into the mix, and the OECD says now more than ever it's important for countries to make sure their mental health systems perform well to help their economies perform well. It says that treatment costs plus associated lower rates of employment and work productivity could add up to 4.2% of GDP. The OECD's zoned in on various indicators to take stock of how to measure mental health system performance. And an important one is about the hospital experience. But nearly 20% of people with a mental health condition said they were not treated with respect and courtesy during their stay. Access to services, now that's another issue. 67% of people who wanted mental health care had difficulties getting it. In fact, 11 OECD countries only have one or fewer psychologists per 10,000 people. Now, I should say that of the 23 indicators of the OECD's mental health benchmark index, only two, life satisfaction and death by suicide, were available for every OECD country. So there is some missing data here. Emily Hewlett is health policy analyst with the OECD, and I asked her about the economic dimensions of untreated mental health issues.
At the OECD, in our new report, we've been trying to develop a framework for understanding mental health system performance and point to some of those indicators that are needed to better understand and therefore improve mental health system performance. What we've offered is a really diverse set of indicators, because mental health system performance is diverse. It's not just about high quality services. It's also about integrated approaches to mental health. It's about good approaches in education or workplaces. It's about innovation and access to new tools. I'll just maybe highlight two things. And both of them are related to asking people what they need to help with their mental health. One is that we've been really impressed with the range of information collection that's gone on through the COVID-19 crisis in terms of tracking population mental health. That's generated invaluable information that governments have been able to act on in really, really real terms. And the other is the focus that the OECD is putting on asking people what their experiences and outcomes from mental health services are. That's what we think is the next frontier in terms of understanding mental health system performance. Really asking people directly, how did you find the service that you received? Did that improve your outcome? And what do you need to receive from your service in order to live a better life and to be able to better manage your mental health condition?
The OECD says there are significant mental health system performance gaps in all countries, but some are implementing policies to tackle social and economic costs of ill health. Who's leading the way? And what are they doing?
So there are good and bad things in all countries, but I'll share some good examples from the three countries who helped us today to launch the report. We were helped to launch the report by Canada, Colombia, and Australia. So three countries with very different health systems, very different mental health systems, who have all been doing great things. Australia has been really showing leadership by putting Indigenous populations at the centre of delivering mental health services, for example, by peer-delivered services. Canada's also implemented the Wellness Together portal, which is a new portal since the start of the COVID-19 crisis, which offers tailored wraparound support, including app-based support, chat-based support for people experiencing mental health difficulties during the crisis. And then Colombia, who's one of the newest OECD members, is introducing new legislation and new support measures, again, since the start of the COVID-19 crisis, telemedicine delivered services to help give mental health care a more central role in the Colombian health system, but actually in the Colombian society as well.